Welcome back, everybody. If I could invite our student speakers up to the panel this afternoon. If you're here, come on up and have a seat at the table. First of all, I would like to greatly thank our students for being here today and taking time out of your busy educational plans to be here on a Friday afternoon. And just as much, I would like to thank your educators and your program faculty for allowing you to come here, especially those of you who are not from the campus. So thank you to the educators of these students helping to coordinate allowing these students to come here today and taking time out to speak with us today. I am once again your genial host, Austin Turner, star of Stage, Screen, and Radioactivity, and we'll go through and allow our students to introduce themselves. If you wouldn't mind telling us which institution you're from and what program you're in. I will say that if you wouldn't mind, each time you speak, turn that microphone toward you and speak nice and clearly into it for us.
Hi, my name is Amber Simpson, and I'm from St. Louis Community College, and I'm in the Clinical Laboratory Technology.
Welcome, Amber.
Hello, everyone. My name is Mohni Khan, and I'm also from St. Louis Community College and in the undergrad of respiratory therapist program.
Thank you.
I'm Gracen Clark. I'm from State Fair Community College, and I'm a current student in the Behavioral Health Support Program.
Hi, my name is Amanda Buck. I'm actually from State Fair Community College as well. I'm a previous first graduate program for the BHS, the first cohort. So.
Wonderful. And again, welcome all four of you, and thank you again very much for being here today. Just like before, we have a couple of questions we've pre-populated, and if we get through those, and we'll open it up for our group. So if you wouldn't mind, ladies, what I'll ask you is, what was it that motivated you to pursue a career in your chosen healthcare field? Was it something particularly that called to you? Were you interested in that profession? What was it that drove you to enter the field of healthcare?
Well, it started with my mom, really. She went to school to do medical coding and billing, and I was about, 11 or so, and we would sit at the kitchen table and we would do our homework together. I'd help her study her flashcards. We looked through her textbooks together, and I realized I really like the healthcare field, and we would watch ER together. And so I'm like, yeah, I want to do this, but I don't want to work with the patients. I like people, but only to a certain degree. And so, yeah, here I am today in my second year, close to graduation, and I'm really excited.
Wonderful, thank you. Mohni, how about you?
I was drawn to the healthcare field and wanted to do or pursue something in the health field, and who can do the direct impact to someone's life, and especially in a critical side. And that's I find this program. I talk to the different people. I work as an interpreter in a different setting too, so speak 2 languages, and then I did get a chance to see different people, like from nursing, doctors, and other people, like different people who were helping the people who are in a critical setting, and that made me pursue in the healthcare. Yeah.
Wonderful, thank you.
So I am in the mental health field, and my family personally struggled with a lot of mental health problems. My grandma had bipolar disorder. Everybody in my family struggles with anxiety. And then also that paired with, I was in a very, very rural community, and my grade level struggled a lot with suicidal ideation. And so I was sitting there with a lot of my friends, and they would sit there and they would talk to me about these problems that they're having. And I'm like, I want to help you, but I don't know how. So I started researching, and the State Fair program popped up, and I was like, that's what I want to do. I want to help people because there are students that need help that don't have access and don't know how to get it. So that's what I decided that I was going to do.
Thank you for sharing that.
I got motivated because I always had a nurture feeling. I experienced trauma at a very young age and for decades long. So I wanted to help somebody. I thought actually radiology is where I started. That wasn't going to fill my cup. Then I thought nursing. Well, that wasn't going to fill my cup either. After getting my own mental health under control, that's where I wanted to be. I wanted to be the person that could help somebody no longer suffer in silence and show them the resources that are available to get that under control. So while I was actually finishing all the prereqs for the nursing program, I asked my navigator, is there anything else? And this was when the BHS program was getting actually building. I waited a whole year for it to start. And so I went into it. The internships that we got to do actually got me a job. I signed a contract with the company I worked for 2 weeks before I graduated college, actually. And I currently, with the program, was able to help me get into a social work program where I'm already completed my bachelor's, and I'm not even have my major done yet. But the credits that transfer were able to do that for me. So.
That's wonderful. Thank you all for sharing that. And you kind of touched upon a topic that we discussed in the first panel this morning, which is the laterality in these healthcare programs and trying to overcome the stigma that if a student doesn't identify or maybe he's not successful in their one step in healthcare, then that doesn't rule out all healthcare. Find the thing that speaks to you, find something else that you can do in that area, and you're great examples of how we can do that and push for that. Thank you all. How did you find out about the programs in your area, whether it be at your institution, in your region of the state? How did you do that research to find out that you wanted to do?
Well, I currently work at St. Clair Hospital in Fenton, and I actually work in the dietary department, and I spent a lot of time working out in the cafeteria, serving food, restocking, cashiering, all that fun stuff. And so I got to talk to a lot of the workers, and I'd look at their badge to, remember their names, and I'm like, oh, okay, so you're nursing, you're laboratory, you're rad tech. And then one of my best friends who also works there, she started going to school for radiology. And I always struggled to figure out what I wanted to do. It's I knew I wanted to do something in the healthcare field, but I didn't know what. So I started where everyone else does. I started on Google. And it always came back to STLCC, which I had actually taken most of my classes at Merrimack, so I was pretty familiar with the school. And so I'm going through all of the, healthcare options, and I come across lab tech. I'm like, oh, what's a lab tech? What do they do? So I Googled it, and I'm like, this sounds really interesting. I'm going to give it a whirl. And yeah, here I am, thanks to Google.
Well, I was interested in going back to school after many years, and I felt lost where to start. So I did get a chance to talk to my colleagues and the student. Well, I did have background because I used to work in EHS, which is the Edwardsville High School, and I worked there as a substitute teacher, and that's the platform, you get a chance to see different people, different teachers, and then they admire me the way they teach and work, and I think whatever that their experience and then their guidance that I learned that, and so first thing what I found that first thing I wanted to find, I need institute who can be close to my house first, and then affordable. That's the other thing that I could do and I can pursue. So I start talking to different people, and then I get a chance to talk. I don't know if you guys are familiar, but I can say the name too. There's one person is Miss Keeley, and then she's director of the program from, I think, the Columbia or somewhere. Then I talked to her on phone, and then she explained me. That was my first start. So I explained me everything. What is this program? I heard about the respiratory therapist program, and then I did get a chance to talk to my professor, and I get a chance to meet Fox. She's right here, and then she encouraged me that I can do that because when you start school after so many times. So then I Google, choose the program which can be suitable, that who has a good passing grades, and then the ratio for being a student connected with the teacher, like a professors, and so that's the way I just start and then get this program started. Yeah.
Wonderful, thank you. Google doing a lot of heavy lifting with
Google
the recruitment stuff.
Google is our friend in these.
But it's interesting to hear that you looked for not just location, how close it was, the affordability, but also some of those programmatic outcomes that a lot of our accrediting bodies ask us to put on the websites, which can help bring students to us if they see how successful we are.
Yeah, it did.
Wonderful.
So I actually thought that I wanted a psychology degree, and I thought I wanted to have a doctorate of psychology. Google, you can't really do a whole lot with that. So I went to Stover High School, I'm sure none of you have heard of it. It's really small. And so, we don't have a lot of those resources to help us. So it was kind of up to me to research and do all the things. And again, affordability. I, knew I wasn't going to be able to afford this like super expensive school to get all this education. So I started looking at state fair programs because I'm like, I think I want to go to state fair. Let's see what we've got. Well, it was the year that Amanda graduated that they really started talking to me about it. But the year before, when they were building it, I had found it on the state fair website by chance. So I was like going through the things. I was looking at the things, first part of the year, no one was doing that. That was just a me thing, I'm sitting there, I'm like, applying to colleges, what do we got? And so I happened upon it, and I was like, what is this? And then my school counselor actually got me in contact with Dina, she runs the program, and she talked to me about it, and I'm like, yeah, because once you graduate after a year of being in program, you will most likely get a job offer. And most of the companies that will hire you will pay for your education to go further. So I was like, that is what I need to do because I want to help people. It'll get me into the field that I need to get into, and hopefully I won't have to pay for it all out of pocket eventually. So yeah.
Like I said, I went into state fair thinking radiology. My end goal, as I was going through my own mental health recovery, I was like, yeah, maybe I want to be psychiatric nurse practitioner. Actually, is what I was thinking. They didn't have that kind of program at State Fair, but the navigator at the time said, well, we're going to start this behavioral health sports program. I'm like, okay, I looked into it, got signed up for a couple of the classes where Dina, who the coordinator is, was teaching one of the classes and pulled me to the dark side of social work.
Yep.
So I decided that, and then being in the field and everything else just helped. But definitely Dina got me hooked.
Yeah.
The school, educated, and just the availability, looking up on Google what even behavioral health support was, because I had no idea, and just what it opened up the whole field for. I can go social work in so many different ways, so it didn't limit me, but having the school have the knowledge, the program to build, just made me really, really interested in the area.
Dina really pushed all of us to do it. Dina would come to classes and psychology classes, and she would say, this is a program. If you want to get to this, she would say, do this first. And you would look interested, and she'd come back to you in the middle of class, and she'd be like, so you're interested in this. And so she really pushed and educated a lot of us when we came into the program.
A lot of us do that when we give a presentation on our programs. If we see an eyebrow twitch, we're hooked.
Oh, yeah.
We're going to come find you. You look like you might be interested. You want to come over? But you highlight one of the biggest things for us, which is if we can make that connection between the interested student and somebody at the institution who can talk about it, it's so much better for us. And also we see, as you said, talking about the high school counselor, if we can make those high school counselors aware that these pathways exist, these programs exist, we got a much better chance of getting the students here. So thank you all. Now, we'll ask this question. There's a couple questions here that are going to ask you for some feedback on your programs, but in general, and don't worry, nobody's going to hold it against you, and nothing gets held against you in a court of law, so we're okay. Please feel free to be honest here. What are your recommendations for us as educators on how we can improve outreach to potential students about our programs, or how can we advertise? We heard about Google, or even finding our programs by accident on the websites. What do we need to be doing to capture those interested students, or what things have we not considered that you would say, hey, this would have helped me in my search in finding a program?
It's kind of funny because everyone I've told, I'm in the lab tech program, and they're like, what on earth is a lab tech? So I'd have to go through the whole, they do this and this, all those, the blood and stuff you have to get from, give to the doctor. I get that, or I will get that. And it got me realizing that maybe people don't realize it's the lab techs that kind of give a preliminary of what the patient has. As you look at ER, house, and they're doing all that stuff, and I'm like, no, it's us. And no offense to the doctors and nurses, they're amazing, but it's us. And I'm like, well, I think going to hospitals, honestly, not just schools, to like a career day type thing, is I see like Webster and a lot of big universities with their little tables and their free pens, just set up in the cafeteria. And like, hey, it's mostly geared towards nurses. And it's like, well, what if like CLT programs did that? Going to, St. Clair, they're like always at St. Clair. And I think that would be a really good start. TV commercials. You always see TV commercials about, like rad tech and all that. And going to high schools. I don't know, just banners on Facebook. But I think those would be really good ideas.
Well, if I had one argument for all those medical shows, like you said, House and Grey's Anatomy and all that doctors don't do the labs and the imaging or the transporting of patients or any of that. And I know it's Hollywood drama and things, but a number of times I've sat there on the couch shaking my head going, that's not the way it really happened. That's my soapbox. What are your recommendations?
I think because in this era, social media is can be a very impactful, that advertise on Instagram and then Facebook. It's a good idea to advertise more, like she said, and I think I agree with her. The commercial, like those advertisement on television, because when they come, it just make you think, oh, okay, this is the program too. And like you said, in high school, I think it's a good idea to introduce that or let the counselors know, because if I talk about my program in high school, because I did get a chance to talk to them and then reach out, and then even like when I explain and restart my journey, it's when students ask me for the senior year, they said, what is respiratory therapist? So I explained them. So I think it's a good idea to let the counselor or enlighten them that what the respiratory program is through the brochure is the right thing. And then, those career fair, because my own kids, they sometimes attend those career fairs too for their undergrad thing. And I think that would make a more event, and then brochure that you can spread, and then those booths that you can host, and then keep those things, and then enlighten and talk to the different people. And the way you said that, she mentioned that one of the counselor at the psychology thing that she came and then mentioned like that you're ready or not. But I think it's a good idea if we just arrange those fairs. I think it will help the students more or come in the program.
Wonderful, thank you. And she's right, all of those ideas are very good. And social media is such a powerful tool for recruitment for our programs. And I often think that not only are some of us obviously older than social media, but some of us are older than internet and computers. So how do we make ourselves knowledgeable on these tools and how to do them? So I know almost all of the institutions obviously take advantage of social media, but how many of you on a program level have your own dedicated social media handles? Lindsay's got her hand up back there. So exactly, she just posted. So something on, again, showing age, Facebook or Instagram or some of the things like that, something you handle at a programmatic level rather than institutional level can be helpful.
Can I add one thing, if it's okay?
Please.
Okay, let me tell you one thing, and please don't get offended. That's the word I learned in this era. I'm so sorry, I never knew, so it introduced to me, so I have to say that too. Otherwise, I was very blunt, I just talk, to the point, and then I finish it. But now I have to say that, please don't get offended. The Facebook, my own kids, what they said, if you wanted to educate the youngsters, please use the Instagram. Don't use the Facebook, because my own kids said, and I asked my son, I said, why don't you have a Facebook account? And he said, this is for old people. And I said, excuse me?
Yeah.
So make sure that where you are projecting and posting your things. So yeah, I think the social media, again, it put a lot of impact, whatever you are projecting or advertising. And the new generation see that. So now it's in our hand that how we project the healthcare program.
It had to be said. Thank you. Thank you for saying that.
So the only thing that I can think of would, and it might be different now because when I was getting this stuff advertised to me, it was the first cohort, and there wasn't even a cohort when I first started looking into it. You know, the program was getting built. But at a lot of the career fairs and stuff, they talk about the nursing and the rad tech and the dentistry and the, you know, all of that. But behavioral health wasn't something that they really talked about a whole lot, because I don't know if it was because the program was getting built and it wasn't available and all of those things. But really, like, that is what I can suggest the most, is just talk more to your current students and the people looking into your programs about every program you have, that, like, every health science program you have, or every, you know, thing like that. And then y'all might want to look into TikTok too. I'm the social media manager for our cohort, and I actually started a TikTok for us because a lot of kids are on TikTok. You know, that's the thing. TikTok, Instagram, that's where you're at. So that's what we started doing. I post on Instagram, Facebook, and TikTok to try to get more people to be educated on our program and what it is, you know, so.
So I'm glad you said it. Thank you. And so the feeling that I always have with that is it's one of those tools that I know I need to embrace, but when I do that, I feel like somebody's old, embarrassing dad trying to make a TikTok.
See, but that is, it's okay, but that's kind of what we look for, you know?
It is, but I think what you highlight is that we need to recruit the students in the programs.
Yes, yeah, that is a big thing. Is like my friends and I are the ones who run the TikTok, and we will get like people into them. And so, and I'm in another club at the college as well, and they start the TikToks and they make their students do it as well. So like just doing the trends and keeping up on the things. I mean, even cringy dancing is good to watch. It'll get people's attention. They'll be like, oh my gosh, look at that. And then they'll be like, oh, what is that? You know? So kind of just getting their attention on things, you know. So even if you think you're embarrassing yourself, it'll get somebody's attention, I promise.
If you're looking for cringe, do I have an account for you?
Yes. A lot has been said, you know, improving. Like, I'd say with our area being very rural and a very new program, just getting out into the schools more, getting out into the schools, commercials, the social media that they're great with, this cohort is. But that's the only thing, getting counselors and advice. You're going to have to get into the career fairs, which is very hard because, again, nobody knows what behavioral health sport is. So getting that out there, me being in the small area, I was able to just like tell my story, tell what I was going through, and it got people interested in it. And so that's having students or prior students that have been successful in the program and after the program to reach out as well, be part of it, instead of a coordinator, no offense, Dina, or somebody just sitting there and giving you facts. How about real life?
How it was.
Let them, the real lived experience and how it went through, and how it has actually helped improve my life, my career, my everything. So it wasn't just learning how to do my job. I learned a lot about myself in it too. So.
That's wonderful. Thank you. And we talk about how early is too early for that outreach, and try to, we talk about high school, and we got to go to middle schools now, and I wonder if my 7-year-old needs to start learning about MRI and CT, but I speak from experience when I say the number of times that I've had a student say, boy, if I only knew that program was there, I wouldn't have spent a year going down this pathway, and I can't transfer the courses to this. And so every time I hear that, I go, okay, earlier.
I started looking for jobs when I was in 8th grade, but I'm over-prepared. But that's what a lot of us in the rural communities do, is we start looking very young, because our counselor, I mean, you get the doctor, the nurse, the lawyer, and then sometimes now we're getting more blue collar people in and all of that, but you don't get the more unknown things. So if you have a program that's not really known, kind of push that out there to let it shine, because you don't know how many people are actually gonna be like, that's really cool, that's what I wanna do, and started doing something else because they wanted to do something like that, but couldn't find a program that fit there.
Which is something that I ran into, is I had no idea about this field at all. And so I was doing the normal nursing route, because that's how I was going to get into the healthcare field. And
that's how you're going to help people.
That's how I was going to help people. So just getting out there and explaining, hey, this isn't a taboo thing anymore, especially being in the mental health field. It's taboo. So getting to the students younger, like you said, yes, middle school. When they're hitting that puberty, that's when they're most impressionable again into their futures.
Yep.
Not just the dollar signs, but the actual rewards from the other stuff too.
Wonderful, thank you. What were some of the aspects about your individual programs that appealed to you? So not just the profession itself, but what were some of the characteristics about the program? Was it the courses? Was it when and where they were delivered, how they were delivered? And what were some things that you thought that could maybe some improvement or things that would need to change going forward in how some of that education, that content is delivered?
Well, I've always really had a love of science, especially anything like biology. We had like a 20-minute discussion about naked mole rats at work yesterday, somehow. I don't know how, but we did. And
as many of us do.
It does.
and so going into the class, I looked at the all the different classes I needed to take for the course. I'm like, okay, so microbiology, which I was nervous about, but I actually ended up really loving, and I hope to specialize in it. And like urinalysis and hematology, blood bank, I'm like, oh, these are really cool classes, and I really like them. So so I definitely the classes definitely appealed. Luckily, I mean that's like the biggest thing. If you like the classes, then you're more readily going to stick to the program and graduate. And as for changes in adapting, our instructors, Alika and Menini, are constantly like changing something, adapting something. They're like, hey, give us your feedback, and do you like review Jeopardy, yay or nay? Do you like these games? What do you feel about this homework assignment? So they're constantly adapting and changing everything, which I think is incredibly wonderful. You don't really see that with a lot of instructors, especially like in high school and stuff. So getting into college and having those teachers is like a breath of fresh air.
Embracing that kind of constant, continuous quality improvement model to see, this is working now, what would you recommend for the future, see what we can do. That's really nice.
Yeah, I like a size of the class, a small size of the class, so that way the professors and the students build up a good relationship, and then they can give importance or like attention in individually to every student, and I think this is a really great thing because that way the students are comfortable with their professor and ask their help, and they don't look busy that way, that they don't give individualized or like individual attention. And the other thing is like what to change the thing. I think it's a good idea to arrange the more study session, but the study sessions is not only with only student basis. I think the study session should be students and the professor should be in there too. So that way that with their advice or but their correction, because I feel like whenever if I talk about myself, if I just do everything right, I'm not gonna remember that. But if I do mistake and someone correct me, so that makes me remember more. So I thought during that, because when you are with your friends and then you are studying or doing like those study sessions, then you just study and sometimes they don't correct you. But the professor point of view is different when they correct you or they explain you. So I think that you will understand.
It is nice, and I see some programs that embrace both the peer evaluation and the instructor evaluation, so you get that from two different areas, and you're right, some people are maybe less likely to provide that critical feedback when you need it as opposed to assuming that the instructor is going to provide it. Yeah. So that's a good idea. What would you recommend?
So the aspects of my program that like really appealed to me is at State Fair, the entire BHS program, like once you're in the program, all your classes are on Zoom. So I can take, if I have something going on, I can have my phone with me and I can, Zoom in from anywhere and I can learn all of that stuff from anywhere. And then also the salary benefits and the job perspectives after you leave, they really stressed how, like, if you will get a job once you graduate. Like, they were like, if you apply yourself and get good grades, you will get a job. And so that really was like job security. You know, I want to have a job when I graduate. I don't want to be just sitting around looking for jobs because I don't know what to do with my degree, you know? And so that was really appealing. And then I honestly think that the way State Fair is doing it, personally for me, is really good. On Tuesdays and Thursdays, how we have it set up is we do online class all day. And on Mondays, Wednesdays, or Fridays, we get to actually go into a company. I'm in Compass Health, and we get to shadow their current community support specialists. So we go and we learn in the field what we're doing actively, as well as learning in class from the readings, doing the homework, personal experiences from our teachers. And so that all combined really just, it embraces the skills that you need and shows you how everything you are learning in class will actually get applied. So
some of the aspects for me is being a single mother. The online courses were awesome. Kid gets sick, can't just call out of school. Hey, no, let's just Zoom in. Great.
Yep.
Also being able to, like she said, going out into the field and working in it. I also worked for Compass Health, where I did my full internship at. So they taught me exactly what they wanted out of me. I got to do shadowing with a CSS, and I actually got to learn groups. I got to learn all the different sides of what Compass Health has. And so it was really appealing that I'm like, oh, cool, I get to already help people, or I'm learning how to help people and get familiar with it. So it was really appealing to me. I didn't even know about how much it made. It was just something, hey, I got to go work and help people. And it really worked with my single mother schedule and all of that stuff. And you still, you still had the time to get a part-time job if you needed it. So it was very, very, very flexible with how they did the didactics. What I feel needs to change or adapt. It's a very new program in our area.
Yeah.
So just getting the feedback, I work with Dina a lot on feedback on some of the barriers I've come into that they can actually correct in the program level. Needing classes to move on to continued education into like bachelor's or master's. There were some classes that I had to take that State Fair can put into that program. So that's what they've been doing, is kind of adapting as they go.
Yep.
So that student feedback and just everybody's feedback is always needed. Never hurts the feedback.
Yep.
That's really nice. And you talk about that kind of blended schedule between the didactic in the classroom and the clinical and within the same week. So somebody learns something one day and they're practicing that skill in the clinic the next day, which is nice.
I do that all the time. We'll be there and I'll be like, actually, we talked about this yesterday. I'm like, whoa, I didn't know I would get applied this fast, you know? So it's just like, in some classes it can feel repetitive to like learn the same things, but you're learning it and then you're applying it and you're like, this is useful. It's not just things I have to learn, you know?
And on the other aspect, then you're learning stuff in the field, and then you come to the classroom and you're like, wait, I've already kind of touched base with that. I've been able to talk to somebody that knows, CBT or has crisis intervention. So they've dealt with it. So now then when you learn about it in school, you're just already one up ahead, knowing that personal experience that you just saw the day before at practicum.
So since you brought it up, if I could ask real quick, many of us in the room in a hurry learned how to transition our education and our programs online during COVID. And it's interesting to see which programs kept that modality and which ones transitioned back to in-person. You talked about Zoom classes with your program. Is that solely the only way they've done, or is there the option of either in-person and Zoom, or are they synchronous or asynchronous?
Right now, the VHS program is Zoom only. But as you continue on in other aspects, they do offer both sides. But with just being a new cohort, new program, that it's just this one way right now, because it gives the opportunity to work like a rural area. So now some of my cohorts were in, whole different areas, towns, area codes, everything, counties. And so they were all able to come in and do this program, whether they're in Clinton, whether in, everywhere. So it made it really more accessible to get people into this program, being that Zoom only. So.
And I will say, our teachers this year, one of them lives in Kansas, and I'm pretty sure the other one's in Germany right now. So, so we get to, and they both, one of them is actively practicing, and I'm not sure about the other one, but they are they have their degrees. They practiced. They have practiced. So while they're teaching, they can tell you personal stories, and you wouldn't get that. I mean, there's not a lot of options in Sedalia in the rural areas to be able to go in and meet in person. So having somebody that is in Kansas, that can tell me how it kind of is over there, and then somebody who was in the Army and the military, and her husband's in the military, and now they're in Germany, telling us how this has helped with them, you don't get that when you only have in-person classes. So
Sure. And I've seen that in some programs. Obviously, with program administration, we have to have somebody on the ground.
Mm-hmm.
But if you need an expert in a certain area, or a guest lecturer, or even somebody who could run an entire class, we now have these options to do them remotely and virtually, and they can be almost anywhere in the world to do that, which is nice.
Yep.
Wonderful, thank you. We often, when we manage our programs, we strive to make sure that our learning environment is welcoming and inclusive for students. What could we do to try to improve on that? Most of us work very hard to make sure that we are accounting for that. What is your experience, and what could we do better?
That's one of the things I love about the healthcare field is that it's so diverse. We've got, the CLT cohort that I'm in is so diverse. We've got someone who's from the Philippines, someone who is, from Ethiopia, and it's really amazing. And, working at St. Clair, there's, I'm in my clinicals right now, and we've got 3 people from the Philippines in the lab. Someone is from somewhere in the Middle East. I never asked her, but she's actually my favorite person that I worked with. She was really amazing. But anyway, I think going to community centers that are in more diverse parts of the city and kind of reaching out to them, be like, hey, we've got this program, and we would like to see if anyone would really like to, do it. And maybe, just going to hospitals that have a really diverse amount of employees, and just talking to them. That's really the only things I can really think of, is just talking to people.
Sometimes it's the simplest things that work the best. Thank you.
Well, I have felt really like home here, and then being heard, and then welcoming in my program. And I like to see, I like in STLCC, that we have students from a different region. And if you see myself, of course, individuality, it's diversity in my classroom. I have a different students from the different region, and then how the faculty, or the people around here, even not only my professors, but the students to each other, how they are show respect or importance, and then listen to each other. And I think that's the environment that we have it. And the only thing that I could say, to show more that they are welcoming, and then they are welcome to in the program or in the school or around you, and then make sure that they can share their ideas and they are being heard from you. So I think this is the kind of impression that the one individual can, because if I talk about myself, that I'm from minority, but the confidence what I get from STLCC, that's amazing. That I could discuss with anyone in my with my professors, and then the students, and anything, and I always feel like that I'm being heard, and then they are ready to listen what my perspective are.
That's wonderful. Thank you. And you said a powerful word in there. You said feeling home. And that's something I know a lot of us strive for. It's not just you feel like you belong in the classroom and you're here and you can succeed, but when you feel like you are home, then you can have that openness and share feedback and get help and express your concerns. And that's what we want. And it's hard sometimes to make that connection.
Let me add one more thing, because if I talk about myself, that because I cover my head, and this is a small example, but I could tell you that it's like staring. It's a very small thing, but staring at people and saying something different, or like I shouldn't say that make other person offended. It's like you could just make other person comfortable to be what they are, attire wise, and they are okay when they are even like around the area. I know people always talk about the workplace, that give other people opportunity to for the eating wise, that some people don't eat meat and that kind of stuff, and then their prayer wise too. But I think it's in a school environment we can improve that part too, because every religion has their different attire that they need to wear and follow, and then their prayers that they need to perform during the school time too, because most of us, like, we are here from morning to middle of the day time, so we need to perform prayer too. So I think it's a good idea to let them practice their own religion thing.
That's great feedback. Thank you. And most of us who have programs who have clinical components have learned how can we adapt our clothing requirements. Students have to wear scrubs, but obviously if they have head coverings, or it's not just they get lunch in the middle of the day, we need to take time for other things, whether it be they're a mother and they need the private space for that, or those components. And it's nice to hear you say we need to consider those, just like they would in the healthcare environment. If it was an employee, we need to make those same considerations for students.
I don't really know what to say. State Fair is so good at making everybody feel welcome and making everybody feel included and valued. Like, I mean, I'm 19. I'm the youngest one in the program. The oldest one in the program is probably older than most. She's 74. She's 74. So we got 19-year-olds, we got 74-year-olds, we got 30-year-olds. We have everybody, and everybody feels included. And we all work together, and we all we all have our own little texting chat, and we all text. So I really don't have any suggestions for State Fair, because they always are like, we are geared towards the non-traditional people. So that is, everybody's included. Everybody gets the same treatment. Everybody gets the same help. And so that really, I think, just is what makes everybody feel welcome and included.
Yeah, State Fair has been really adaptable, but overall, making a learning environment just more appeasing is just keep putting it out there.
Yep.
Get that out there, show it. People do TikToks in the classroom, or just getting out into the community and just expressing, hey, this is our classroom, or these cohorts. These are our classroom. It's very inviting. It's very family.
Yep.
I still talk to all my cohorts.
Yep.
And it's like we're sisters. There's monthly check-ins. And so just putting that out there, that's what these programs actually you turn into, or cohorts. You turn into a family. You learn together. You graduate together. And putting that out there, a lot of people don't know that. They think it's just, oh, you're in a classroom full of people.
Yep.
You're learning, finish class, go on. No, the programs are your cohorts. They are your people. They are your family. Throughout the program. People don't know that, so I think advertising that or showing that will help a lot.
Yeah.
And then that showing is a big part, because a lot of us can say, but it's the doing and it's the demonstrating, I think, is this most impactful. Like you say, we can say we are inclusive, but when we can show that we are, that speaks for us, which is really nice.
Yep.
We're near the end of our time, so I'd like to open it up to our audience. Does anybody have any questions or feedback for the students that they would like to ask? And I will try to run back and find you real quick.
I have a question. So earlier today, Jill was sharing workforce data with us and why students leave healthcare programs. Most of it is personal. It's not because you're not prepared and ready academically for that program, but there are life things that happen. So at your respective colleges, or just in general, was there a support service that you either wish you would have had, or that you needed, or maybe it was something that is particular to your college that you had, that you were like, this is what helped me, number one, be successful? What would that be?
Great question. Thank you.
I'm not really sure. I've been incredibly lucky. I have a great support system at home and actually at my job. So if I ever have problems for whatever reason, I'm always like, I can go to my bosses and they'll be like, okay, well, let's work this out. I can go to my mom. She's like, all right, we got this. But yeah, I don't know, something like that, which I think could be amongst your cohort, because like they said, it's your home, it's your family. Mm-hmm. And, you got to support each other because, we're all in this together.
Well, I think the reason to leave the healthcare, because either we like it or not, but it's a lot of work. Mm-hmm. It's a lot of responsibility, a lot of component that you need to absorb it. But in this era, and I'm so sorry again, don't get offended. So it's we wanted to wake up tomorrow and wanted to be a millionaire. Mm-hmm. Real world, it's not gonna happen. Only in shows, yes. Like, because we follow different shows and we always see, okay, the other person is a millionaire or successful in that program, but we never find the journey what they had. So I think it's a good idea if people just post their journey too, like what struggles they had it. So I think that would be helpful for the new generation, like a student, especially the youngsters. And the help-wise is, let me give my example to you guys. When you restart schooling after a big gap, it's really hard. Mm-hmm. For the youngsters, because I'm so sorry, they're lazy.
Yeah.
I have my own kids too. And I'm so sorry, please, again, I told you guys that don't get offended.
No, I agree with you.
And because I have my own kids too, they wanted to done quickly. Yep. They wanted to do right away. Mm-hmm. But here, like a support system, we have to be supportive towards each other. Even in my class, the first thing when I start this program, my classmates said, this is our family for next 2 years. Mm-hmm. Mm-hmm. So we have to live together. Like yesterday, I had a really bad, I don't know if it was anxiety, because it seemed like I'm a very confident woman, but that's what I was thinking about me. But I think I had a rough time, and then I thought probably this program is not for me. Suddenly, I feel like, because, when you just pass, and a really great score, and then suddenly you feel like, oh, you're losing it. Mm-hmm. Then the other people part started. So my classmate jumped in, and then they said, and I really admire if they're, I hope they listen this part. They said that you're not gonna quit the program. You could try, but we are not gonna let you. Yeah. That's the straight words I'm copying from she's younger than me, but the way they give me support, that was incredible. Then my professor, again, they said, calm down, give yourself some time, and then you will be fine. Do your best, and we are here to help. So that's the support that we want, or the students want from their professor. So come directly to them. Mm-hmm. And every student is student, no matter of what age. Mm-hmm. Inside, there was always a fear. Either we like it or not, we have to pass the exam, either in good grades or bad grades, to move on. So just for the students who wanted to show some support, show encouragement, more encouragement, make them or feel them valuable, because I do have a background of education too. That's why I'm just talking as a teacher and then as a student perspective both. So as a student, inside we are little kid in any age. We need support from our professor. We need lots of encouragement, and we feel like, oh, if someone just said everything will be okay, that's the biggest thing. And then no one is gonna leave the education. Trust me, it just, everyone, I think most of us wanted to be educated.
Yeah.
I thought I recognized a teacher voice in there.
Yeah, thank you.
So I'm going to let you answer. I just want to brag for a moment. One of the things that I'm proud of, and most of us here at St. Louis Community College is that we have those academic resources, we have those advisory and tutoring resources, we have library services. We try to identify those openly accessible or low cost or free educational materials and textbooks, but we also have those resources for students who find themselves unhoused, or they don't have access to food, or they need clothing, and so we have those resources as well. But you hit the nail on the head when you said it. Sometimes it's those things that just your peers and your teachers, just that encouragement. So it's nice having that wide array of resources available if needed.
Let me share you one example here, because I work and I go to the different school, not the school, but different school and then classes too. So I have different ages of my students as well. Being a substitute, you go and teach the different students and they have different prospects. So one of the student, and let me tell you that it's so wonderful, and I felt really good inside. The student was in the honors class in psychology and wanted to drop the class because it was too much work in there, and he thought that it's not, and I said, just take a deep breath and then go back to the class, at least start it, and then see how you like it, and then show some support and talk, especially reach out to your teacher and then see how probably you're thinking like a personality wise that the teacher is strict and not going to give you the right answer. What if the teacher is mean? That's the one thing always come in the student mind, that what the teacher is mean or like disrespectful, that kind of like student's perspective, I'm telling you. So because I was not directly his student, but he asked me to that, and then he came after a couple of weeks to me, and then he said, I stayed in that program and then in the class, and I'm enjoying it. I'm loving it. So from the teacher perspective, those are just words that we use wisely towards our students. I think that will be helpful.
Great, thank you. How about State Fair?
State Fair has a lot of great programs. The first thing I will say is both of my teachers, Dina is one of my teachers, and then Wendy is the other one, very, very supportive. If you are going to have a late assignment and you know it, you talk to them and they'll be like, it's fine, just get it turned in when you have time. Like, you're not going to get point stocked, because they know in the program you have a child. I take care of my cousin and my nephew, and so they're like, I've had them in class with me before on Zoom. Everybody's get to see my little nephew like doing whatever. They're just very supportive, and they're like, do what you need to do to get your stuff done. And then State Fair wise, I know that they have free food for kids on campus as well, but also what really stands out to me at State Fair, and you guys might have this too, but we have every student has 6 free counseling sessions through CMU. And Dina has really told us, like, take advantage of this, use this. If you're having a rough time and you can't talk to somebody, talk to them. And all of the other teachers have the flyers in their room. They say, if you guys are really struggling, midterms is a really hard time, finals is a really hard time, go make an appointment. Talk to one of these people, because it's free. Take advantage of it. So that's really what I think is they're very supportive, and especially that counseling is like top tier with us,
But she's kind of touched base on it. Just the instructors, the coordinators, the navigators, advisors, be real. Help when we come to you, but be understanding.
Yep.
Like she touched base, Dina, and State Fair has always been very understanding. I became displaced in the middle of the program and couldn't get my homework done, and reached out to my coordinator, reached out to the instructors, and they were very, very understanding. I got to turn in the assignments late with no penalized. So just listen to the students and just being very supportive of your cohorts.
I will also say a lot of our teachers can tell when a student is struggling, and they will personally, not in front of everybody, but they will message them, or they will email them, or they'll be like, hey, can you stay after class? I want to talk to you. I know I personally was having a little bit of difficulty wondering if the field was right for me, and I was like, hey, Dina, I need to talk to you after class. Is that okay? And we stayed there, and she talked to me, and she could tell that like I was really having some problems thinking that I wasn't right for the field, and she expressed to me that like, no, these are good signs. She also, and Wendy both are like, hey, you're looking a little tired today. You're not talking as much today. Like, they know their students, and they make the effort to reach out. And they're one of the only people I know at State Fair that take that initiative to go and talk to their students. And they do have small classes, so that might make it easier. But if they tell us, like, I'm sure if Dina saw you struggling a little bit last year, and I mean, she's seen my friends struggle, she reaches out to them.
100%.
That's the big thing.
She noticed through even the recordings of our classes, because there are some that can't make it to class. So
Yep.
that's another awesome thing about the BHS program is you can go in and watch a recording
Yep.
and still get the lecture part. Well, they noticed that I was off, my demeanor. So yes, Dina reached out. And Dr. Wendy Hampton reached out because they knew that wasn't like me.
Yep.
And yes, I was struggling. So they were also able to help me with some resources
Yep.
or guidance and just some reassurance. So that was really helpful.
So
Yes.
that willingness of the faculty to engage rather than
Yes.
wait on the student. That's
Yes.
wonderful. I don't know about the rest of you, but I can spend the rest of the day engaging this panel because I'm getting a lot of great information, but I'll be respectful of our time. So thank you all very much for your time and for being here today. All of your faculty have been instructed to give you bonus points for today, so we appreciate it. But with that, well, thank you, and we will get ready for our next session. So thank you.
Thanks for having us.
Thank you, guys.
Thank you.